We are seeing cervical cancer in the 21st century, and it is more harmful than doctors originally thought. We get you more tonight, including the high-profile sportscaster now opening up about her own personal battle. Well, she's the co-host of ABC's Dancing with the Stars and a sports reporter, one of the most famous in the business. Erin Andrews just revealed she had surgery for cervical cancer. This news comes as new research shows this type of cancer is much deadlier than previously thought. ABC 7 weekend anchor Brian Anderson is here getting us more tonight. Brian?
Emily, African-American women are dying from cervical cancer at a rate 77% higher than previously thought. The cancer is proving to be 47% more deadly for white women. One common contributor among all cervical cancer cases is healthcare access. 6 weeks of chemo and radiation.
So I had to just stay as strong as I could.
Followed by 4 days of internal radiation. Heidi Patron shares a few pictures from her cervical cancer treatment a year and a half ago.
I started bleeding profusely.
A health emergency led to her diagnosis. Heidi says she didn't receive routine health screenings.
I cannot afford it. It's either I pay for health care or I have a roof over my head. Which one do I want?
As a society, it's our fault when women develop cervical cancer.
Dr. Fadi Abu Shahin is a women's health physician in Fort Myers.
The most common cause is lack of insurance. When you don't have health insurance, you're not going to go get a pap smear.
Which, he says, is the best cervical cancer screening test.
Not only it allows us to catch cervical cancer early, but it allows us to find the precancerous lesions.
Lesions that he says smoking can contribute to, as well as birth control. All of this adding insult to injury for women who can't afford preventative health care.
I would hate for somebody to have it go unnoticed and pass away from something that could have been prevented.
The American Cancer Society says the risk of cervical cancer increases the longer a woman takes birth control pills. The society saying it takes about 10 years after stopping this kind of contraceptive for the risk to decrease to normal levels. Emily?
Some good information, Brian. Well, the treatment for most stages of cervical cancer includes surgery, such as a hysterectomy, chemotherapy, and radiation therapy. If you are age 26 or younger, you can get the HPV vaccine, which protects against types of HPV that cause most cases of cervical cancer.